This is part 4. I will discuss the interventional framework for stroke patients. I want to highlight some key components to providing stroke rehabilitation. First, it's important to keep in mind the importance of education, not just to the individual, but also to the family members involved. Also, to have assessment from all disciplines, all therapies. This multi-interdisciplinary approach is found to be the most helpful and effective for treating patients with strokes. Next, patients find it very helpful to provide any prognosis of their condition and their course of recovery. This gives them a sense of control of what to expect next, and it also allows them to feel motivated. Next, I encourage all the providers to keep in mind the adjustment difficulties, emotional changes such as depression, pain, as well as sleep. Those are very common things that happen during stroke rehabilitation. And we know that we can manage those things, both from a pharmacological perspective as well as a behavioral perspective. Emphasis on managing ADLs and IADLs, activities of daily living, are also essential to stroke rehabilitation. Individuals really want to strive for independence. They want to get their old lives back. So in rehabilitation, it's important for us to focus in those key areas so that they can function as best as they can. To start off, I want to share with all of you a treatment framework that is based on theory as well as evidence. As we know, every stroke presents differently. In my previous presentation, I talked about left-sided stroke versus right-sided strokes. Gave you a general framework about how to think about stroke regions. However, I want us to keep in mind that every single patient is unique with different host of post-stroke sequelae and deficits. So that's really important to keep in mind. Next, I encourage constant collaboration and active engagement on the part of the patient. The research also shows that when someone is actively engaged, actively collaborating with their therapist, that their outcomes are much better. And they tend to have much better functional outcomes. It's important from the beginning to instill a sense of hope and encouragement, to highlight the positive trajectory, especially during the early stages of recovery. And lastly, I always think about who in the lives of those patients can support them. I involve support from family members and friends as much as possible. And I encourage them to come and visit my patients when I can. This next slide highlights the current evidence of the treatments that we have that promote cognitive rehabilitation after a stroke. We know that there is strong evidence for visual spatial training for neglect syndromes. For example, in my previous slides, I've talked about left-sided neglect. The reason why I want to highlight this treatment is because visual spatial rehab not only enhances awareness to the left hemispace, but it's been found to be also correlated with improvement in memory, language, and global cognitive function. There's also good evidence for language treatment after a stroke. also known as aphasia treatment. Here, I want us to think about basic principles in our visual-spatial rehabilitation. Because when we work with patients, as much as possible, I find it very helpful to incorporate this to maximize opportunities for visual-spatial rehabilitation. The first thing that I want us to think about is in terms of locus of the stimulus. So individuals who have, for example, left-sided neglect will often focus much more on the right side. Even though there might be visual stimuli on the left page of the book, they will only focus on the right side and the right page. The next thing is anchoring. Again, anchoring is the concept where you're cueing the patient to attend to the left side. So for example, here in this book, if I were to work with a patient, I would consistently cue the patient to read all the way to the left side of the page. That frequent cueing and consistent cueing also enhances general visual scanning. Next is the concept of pacing. So individuals with left-sided neglect also have a tendency to not only focus on the right side of their visual field or the right page, but generally the right bottom quadrant of the page. So similarly, it's important to raise awareness to our patients to make sure that they scan to the left and look at all corners of the book. Density is another concept that's important in visual-spatial rehabilitation. This is where the more information, more visual information that you show them, the denser it is, the harder for them to visually process. And so as a result, they might end up not wanting to read a book because there's just too much going on those pages. So here, we help patients realize that they can still read written material. They can still read books. We may enlarge the fonts, make the fonts clearer, or space the words apart. The next idea is information load. Information load is similar in the sense that there's just too much going on. The more simple, clear, concise information you're able to give visually will help patients engage more and be able to read and scan better. Lastly, I find this to be very helpful. That is, I have patients predict how well they'll do on a visual task, such as reading. I'll have them engage in the task, and thereafter, I'll provide them objective feedback in the moment to help them see how they did. That often helps to raise awareness and insight, and consequently, it helps them to feel motivated for more vision rehab. Here are some key assessment and interventions that have been helpful. The first is assessment of visual scanning and training using single and double cancellation. Now, used in conjunction with that, when you add on computerized visual scanning training, that seems to have some additive benefits. Next, with the problem of neglect dyslexia, often when you have patients read a paragraph or copy a paragraph, prose, that has been shown to be quite effective for vision rehab training. And lastly, helping them to visually scan pictures. So being able to have them attend to all four corners of the picture, for example, that has been quite helpful. Some strategies that I have incorporated in my work that is based on evidence is the lighthouse strategy. This is where I have patients imagine themselves as a lighthouse and be able to scan all the way to their left and all the way to the right, ensuring full vision and ensuring that they don't miss anything. I incorporate that in my treatment sessions. Another strategy that I find to be quite helpful is incorporating visual spatial motor strategies. So I may have patients place their hands on the left side of their book to ensure that when they read, they're reading the entire sentence and they're scanning all the way to the left. Now, I want to quickly talk about aphasia treatments and the evidence behind it. There is good evidence to suggest that constraint-induced language therapy is beneficial for patients who have chronic aphasia. This is where you encourage patients to talk and use their verbal skills instead of, let's just say, using thumbs up or thumbs down for communication. Many times we often modify what we do with patients to enhance their understanding, but it's been found that when we require patients to best utilize their verbal skills, their expressive skills, that allows them the opportunity to recover in those areas. Next, there is also moderate evidence to suggest that supported conversation for adults with aphasia can enhance conversational skills. This is similar conceptually in that, again, here we are promoting the use of talking and language skills instead of modifying approaches to communicate. There is moderate evidence that suggests that task-specific semantic therapy and task-specific phonological therapy is helpful, and also cognitive linguistic treatment also helps with verbal fluency and verbal expression. Also, in addition, it's also been found that with regards to writing treatment, if you can do that at an individual one-on-one therapy level, that shows that it's much better than doing it in a group context. So just keep that in mind. Again, we know that intensive speech and language treatment is the most helpful. That's based on the evidence. And lastly, that trained volunteers can also help with improving language skills.